Hi, my name is Tara Hornbeck. I'm a board-certified adult gerontology clinical nurse specialist. I currently work in the Accountable Care Organization, where I manage our post-acute care coordination with 10 different long-term care facilities. With those long-term care facilities, I've worked diligently in the last 2 years to establish relationships with all of them to influence the length of stay in long-term care, the emergency room utilization from long-term care, as well as the 30-day readmission rate in long-term care. In the last 2 years, I've been able to decrease our length of stay by 5 days. I've also been able to decrease the emergency room utilization as well as the 30-day readmission rate. I was able to do this by coordinating with multiple care personnel, including a nurse practitioner in a healthy living center, where we were coordinating together to establish and develop an education program for our long-term care staff members. We developed a congestive heart failure as well as a chronic obstructive pulmonary disease module set to educate the nurses in long-term care as well as therapists who wanted to participate on early recognition and symptom management of those disease processes. I've always wanted to lead change in healthcare. I love watching the transformation. I love most of all digging down to see where the problem is actually starting. I'm often described as an individual who comes into work and hits the ground running. If it's not reviewing cases or taking care of patients or just simply having conversations with frontline staff and building those relationships to allow further coordination in the future as well as influence when I'm implementing change, that is how I go through my days. I'm almost always smiling and very approachable. In the past, I've worked in various roles. I worked in long-term care, where I was working with geriatric patients at the bedside. I transitioned to inpatient rehab, where not only did I work as a bedside nurse, but I was the education coordinator in the inpatient rehab center. Even in inpatient rehab, I formed process improvements. In the inpatient rehab, when working there for 2 to 3 years, I developed a hospital-acquired pressure ulcer prevention program. We found that our hospital-acquired pressure rates were elevated, but with the implementation of my program, we were able to decrease our hospital-acquired pressure ulcers to 0. I then transitioned to intensive care unit, where sepsis was our number one admitting diagnosis. Sepsis being a very complex disease process, it was definitely a puzzle to solve. I had to collaborate with multiple units, departments, personnel to determine where the problem was occurring. We found that with the hospital that we were not using early recognition in regards to what the evidence-based practice from the sepsis campaign was telling us. Throughout diving into charts and doing case reviews, we found that we needed to start the process in the emergency room department. When we did start the process in the emergency room department and carried it through the continuum, we were able to decrease our sepsis mortality rate by 50%. Other projects I have participated in the intensive care unit also included pressure ulcer decreasing. We decreased pressure ulcers, actually just the reportables, to no reportables within 1 year after establishing a personalized care plan for patients. We were able to work together and review evidence base, and I facilitated as we developed a care plan for individuals that would be at high risk for those pressure ulcers developing. We also looked at medical equipment, which is still a challenging area for us. I later, like I said, transitioned to the post-acute. I did also do wound care practices in between, where I worked in our advanced wound healing center. All of this education that I've learned throughout the way has only continued to build my strengths and skills. I use all my skills in leadership. My leaderships and skills include restorative, achiever, input, focus, adaptability. My focus and input allow me to focus on the situations and really drill down, gathering input to determine what the problem is actually occurring. Adaptability allows me to change my priorities. What problem that is currently occurring needs to be top focus. My achiever allows me to meet deadlines and meet outcomes. I'm always striving to hit the mark. Restorative, I like to repair the process. I have been described as a tornado in the past. At first I was like, is that a compliment? A tornado to me is, yes, can cause destruction, but it's like a breakdown of processes. I look at it as the debris part. A tornado leaves a lot of debris. We have a lot of broken processes, and to me, we have a lot of debris. So I salvage those processes or salvage the debris, looking through processes and work with different individuals trying to prioritize and repair those processes. Throughout my healthcare career, I've always worked to try to be a leader and someone to look up to, mentor, and to teach and grow others. As I look up to individuals who have grown me, I want to continue to work in healthcare for many years to come. And I like to learn as I go, as well as our new lean transformation that seems to be taking over healthcare. I work closely with lean individuals, trying to continually tell them that not everything can be lean and standardized. We have a complex healthcare system. There is a lot of opportunity for lean, but we need to make sure that we are not doing one-size-fits-all care to everyone. We are all individuals, and often we are going to need individualized care plans for different disease processes. This does not mean that we cannot standardize different dressing changes, different processes that are repetitive. That is the ideal place for lean transformation. I do think that moving forward as healthcare providers, all of us need to be aware of our cost spending, our quality. We need to know what our baseline is, as well as measure our outcomes to show return on investment for our quality practices, which support us in our healthcare endeavors. As I said, I really love the system levels, solving puzzles, and creating new processes, working collaboratively with others. I will show a short video showing the relationships I have established throughout the continuum of care. Most in healthcare, some outside of healthcare, but most of all, even if not in healthcare, often representing different charities, raising money for different healthcare solutions. Thank you.